What's up, crew? Welcome to the Pardon My Pancreas podcast. Today we have a guest for you, Dr. Polonsky. He's going to talk to us about mental toughness, how to cope with diabetes burnout, strategies he's encountered and come up with along the way, along with some really interesting topics covering different levels of distress that I've experienced. And you kind of see a window into my own life with my own blood sugars, the stresses caused, and I even share a story about a panic attack that I had that you won't want to miss. So, without any further ado, let's get into our interview. I've spent the last 10 years pushing the limits while identifying trends and patterns in my type 1 diabetes management. Follow along as I learn, apply, and share the fitness, nutrition, and lifestyle strategies that I've learned from diabetes experts around the world. The real question is, how can we live fearlessly with diabetes while maintaining stable blood sugars? This podcast is here to give you the answer. My name is Matt Vandervecht, head coach and co-founder of FTF Warrior, and welcome to Pardon My Pancreas. All right, well, Dr. Polonsky, welcome to the Pardon My Pancreas podcast. I am thrilled to have a chance to chat with you today and get to know you, but also a lot of the work you've done and some of the discussions that have been had around mental health and diabetes. Before we jump in, I want to give you kind of an intro so that everybody watching knows a bit more about you. I'm sure many people have already heard your name. So Dr. Polonsky, you are an associate clinical professor in medicine at the University of California, San Diego. So fellow San Diegan, I love that. You received your PhD in clinical psychology from Yale University, have served as a senior psychologist at the Joslin Diabetes Center in Boston, a faculty member at Harvard Medical School, and chairman of the National Certification Board for Diabetes Educators, and I believe founder, though I know at the very least you're one of the head honchos at the Behavioral Institute for Diabetes. Is that right?
Yeah, I'm the co-founder and president of we call it the Behavioral Diabetes Institute.
I've got the order wrong. There you go.
Yeah, it's close enough. Well, I just mention I'm very proud of the institute. We call it the BDI because it remains the world's first and only organization that's wholly dedicated to addressing the unmet emotional needs of people with diabetes. So that's our baby and probably what we're most proud of.
Oh my goodness. How long ago was that founded?
In a few months, it'll be 20 years.
Oh, wow. How
So it's going to be almost a grown-up.
I love that. So what was the initial, if we can just dive in, I'd love to get some history on the organization. What was the initial spur or motivation to start that organization?
Well, it allowed me to, bring together things I've been doing since the late 80s. I'm by training a diabetes psychologist, and I've always had these different parts of my life. And I met other colleagues also where we were still clinicians. We were still seeing people who were struggling with diabetes every day. We were also doing lots and lots of research, trying to understand and address the emotional and motivational and behavioral side of diabetes. And also we were doing a lot of consulting for companies and training healthcare providers around the country and around the world. And we had all these different pieces. And we said, let's bring that together into one facility. So that's why we decided to have the BDI as our home from which we could have all these different strands, which have actually led to other strands over the years. But I'm just so proud of it. I'm really glad to be a part of it.
Wow. And what initially got you into the study of diabetes?
Oh my goodness, I wish I had a good story. I don't have the world's best story, but I'll tell you, I am by initial training was called a clinical health psychologist. And it's too long of a story, but just by accident, complete accident, I happened to stumble into the Joslin Diabetes Center in Boston, where I was thinking of making a change. And we were just chatting with some of the people working there, and they said, I don't think we really ever hired anyone like you here before. We're not really sure there's a need for someone like you at a diabetes center, but if you're interested, why don't you come work here for a few months? Let's see what happens. And I went, well, I don't really know either. Let's find out. So I was truly ignorant and a babe in the woods. And I still remember my first day of work and went, what the heck am I supposed to do? And luckily, the Joslin I didn't realize at the time it was the biggest diabetes center in the world and had this huge waiting room full of people. So I just started walking up to people and saying, hey, sorry to bother you, but if you don't mind, could you tell me what's living with diabetes like for you? And the first person I asked looked at me in shock and said something that really surprised me. She said, thank you. I went, are you talking to me? What are you talking? Thank you. She says, well, I've had type 1 for 30 years and no one's ever asked me that question before.
Mm.
And I'll tell you what living with type 1 is like. And she began to tell me the ups and downs. And then I went to the next person and the exact same thing happened. And I went to a third person, the exact same thing happened. And it became clear that, wow, there's a lot of people struggling and no one's not just not helping, no one's even asking, no one's even noticed this is going on. So I just felt like from that day forward, I was the luckiest person in the world that I had this chance to learn about something no one was really paying attention to, at least not as academics and clinicians, and that there was an opportunity to make a real difference. And I, I just feel lucky every day I'm in this field, and I'm still asking the same question all the time. What's living with diabetes like for you? And opens every door.
I think that's a fantastic story. I don't know what you're talking about. That's a great intro to the world of diabetes. And I think that's such a powerful statement too, and simple. Thank you. It's unexpected, but the reality is that was largely overlooked, I think, the mental health side of diabetes as a second consequence of diagnosis. The primary consequence is take care of blood sugars, and that's 99% of what is discussed in doctors' offices. And I think that now we're seeing kind of a surfacing of mental health professionals being introduced to newly diagnosed patients. But I think it's a fantastic department, and I hope that they've grown that since you've been there, and certainly seen a need for it. What has your experience been with that?
Yeah, I mean, the number of people who are diabetes psychologists remains unbelievably low.
Mhm.
But things have definitely grown. And just like you said, there's very slowly been an appreciation of the personal or emotional side of diabetes.
Mhm.
It's unfortunate though. Still, I would say the majority of people I meet will still complain about this in terms of their healthcare provider. I feel like I'm treated like my numbers, not me as a person. So I guess to put it as nicely as I can, there's a lot of opportunities for making this better.
I think that's fair to say. Well, I'm curious about your thoughts on this then, the age-old discussion of person with diabetes or diabetic. What do you have to say about that?
Well, I've heard you use both, by the way, and I think that's up to you. I feel like as a person who does not have diabetes, um, for me, the most respectful and polite thing to do is not to use the word diabetic anymore. But I'm not walking around telling people who have diabetes they can't use it. That's ridiculous. But for people who don't have diabetes, I think it's simply respectful because you are more than your diabetes. So, but it's a nice, person with diabetes is a lot of syllables. Diabetics, a couple. So I understand how that can happen and how people use it. So I say it's up to the individual, but I will hassle all healthcare providers to please stop doing that.
Mm. Yeah, I think that that's a fair point, right? Where if they're living with diabetes, to have their own perspective, it doesn't define me, but I can still use the term diabetic. And you mentioned how diabetes is not all that they are, and sometimes I'll be honest, I fight that because I have obviously type 1 myself. My job is type 1. My life is learning more about type 1. My sister has type 1. It's like, whoa, where does it stop? But I can certainly appreciate that, and I love that perspective.
Yeah.
Uh, and within, type 1 and mental health, you have made it clear that there's a greater need for that than is being met. But in your practice, what have you noticed is most effective in assisting from the outside?
Oh, I'd say there's a couple things, and I bet you're doing this in your work in your practice. The most important thing that we see that helps people is to help them move beyond isolation. When
Mm.
people are alone with diabetes, it's just often a recipe for problems. Um, we know that degree to which people end up, I just talked to someone this morning about this. You end up kind of feeling bad, you're a bad person, blame and the shame and the guilt. Why am I not doing better? I should be focused on this. And it's only when you start talking to other people who are living with type 1, that you go, oh, wait a minute. There's a lot of other people who are feeling just as hassled and freaked out and exhausted and aggravated from time to time. And once you start to feel a little more normal, then there's opportunity for change. then there's opportunity for moving forward. But it's hard when you feel like you're the only one and you're alone with this. And, most people with type 1 don't know anybody else with type 1.
Mm-hmm.
So I have to just start there and say that's the single most important thing. If we can help people get connected, I'd say maybe half the people come to see me. They don't need to see me. I just need to go host a party with a lot of other people with type 1 and have them meet them, which sometimes we do, actually. And that makes a difference. I'm going to say something else. Because of the pandemic, we stopped doing this, but we used to do a lot of small, structured group programs for people with diabetes.
Mm.
And they were always limited in time. And at the end of every program, I used to go around the room and I'd say, could you tell me what, if anything, have you found useful about being here? What's been useful about being in this group? And in truth, when I originally used to ask that question, between you and me, I was kind of fishing for compliments. Like, tell me what you liked about this program. So you can imagine how disappointed I was when the first person said, Sam says, what I like about this program? I got to meet Bob. And Bob, sitting over there, he really gets it. He really understands. He's been through some of the same things I am, and that's been really great. And now I go, okay, that's nice. And Sally says, what's been great about this? I got to meet, Gladys over there. And boy, she really understands what I'm going. Now I'm getting upset. Like, wait a minute here. But it didn't take us long to realize that we just had to shift our expectations and what we were really doing. That I didn't have to be, group therapist. I had to be the host of the party.
Mm-hmm.
And we see this now in different groups and programs all over the country now. We see them in virtual groups. We see it even what are called group medical appointments, where small groups of people will meet with their physician on a regular basis, which is phenomenal. And people learn from each other. Anyway, sorry to go off on a tangent about that, but that's clearly number one.
No, that's fantastic. And you mentioned isolation, and how you can break that to get support, get other people around you who get it. I think it's a powerful concept in by itself. We actually ran a challenge recently where the whole point of the challenge was to get people to 90% time in range or better, like show them what are the tactics to do that. And afterwards, we had somebody post a comment and ask, am I allowed to have an off day? Am I allowed to have a bad day? Am I allowed to be mad about my diabetes? And I thought it was this fantastic learning opportunity. So I had to use myself as an example. And I was like, I had a bad day yesterday. Like, of course you're allowed to have bad days. Everyone does. And, the comments were filled with support and it was incredible. The community came to support them. But I think that without the community, we have a bad day and we think that we are the only person failing with this. And it's so destructive. And so as you mentioned, to your credit, right, if you aren't isolated, you can see others also have bad days or ask questions like that. Am I allowed to have a bad day? It's so crucial.
You're right. That's where people often trip themselves up because of their own expectations. And, one expectation really is when you think about A1C or time in range, what should I be aiming at so that I can be in a safe place? And I hear people all the time who are just kicking themselves that they go, I should be in 100% time in range. What a loser I am that I can't do that. It's like, well, I don't know that's possible. And even if it is, I'm not sure how much of your life you'll have left. Maybe. But I still remember this endocrinologist just a couple of years ago said to me, he said, the international goal for folks with type 1, if you're on CGM, is to aim for at least a time in range of 70%. And at 70%, the data looks pretty good. That means you're in a pretty safe place moving forward. And he said, what 70% time in range means is that you're out of range 6 hours a day. I went, wow, so much for being perfect, so it's anyway, but it's an ongoing controversy. What kind of goals should I have and can I obtain them? Because I see everybody trying to find, like the guy you mentioned, sort of this point of compromise. Like, what's my goal in terms of paying attention to my diabetes and how much time I want to invest? And at the same time, I don't want to think about diabetes at all. And I want to live my life and do anything I want. So where's my compromise point? And that could be different from person to person. So,
Absolutely. Well, yeah, and I get on the phone with a lot of people who say, "Well, I want 100% time in range," and I'm like, "Well, you could get there, but like at what sacrifice, right? At what cost? Like, sure, you can eat the same thing every day; it still might not work perfect, but you can try." And all this restriction, and I like to redirect the conversation to let's find health, the good blood sugars, but also balanced with quality of life, right? Like, how can I have fun foods? How can I go exercise and live my life and travel, right? And I think that's the question we have to be asking ourselves is how can I? Where is that balance that you're talking about? But
we
I'm
also
also
don't talk enough
curious.
about, and mostly because we don't know. So, what's the difference between 80% time in range, let's say, and 100% time in range in terms of how much extra, how much safer are you?
Hmm,
To what degree have you reduced your risk of scary long-term complications? Um, we tend to think of it as what we call a linear effect, which is, well, the better I'm doing, the better I'm doing. But,
hmm,
there's at some point there's vanishing returns. Like we know if you have, to go back to A1C, if you have an A1C of 9%, and I can help you get it to 7.5, we've dramatically lowered your risk of complications. But if you're at, say, 6.5, and I can help you get to an A1C of 6, our best evidence suggests that's going to help you some, but not a lot, and the risk isn't going to be lowered very much compared to that huge improvement from say 9 to 7.5 or something like that. I know you understand this. I think it's important for people to hear that because you can drive yourself crazy, and
right.
that's the problem.
Well, and that's actually the exact point I was going to bring up next was this massive improvement from 9 to 8, from 8 to 7, and then 7 to 6 is like, I mean, good job, right? But that's not as massive as the previous sleep. And then a 6 to a 5 is like, nah, it's good. It's still better, I guess, but like at what cost? And it kind of gets into a question of how close to that 4.9 do we need to get? You don't have to get right there, right? So I think it's a great discussion to be aware of. Yeah, sub 7 is one of the biggest assists in avoiding risk of complications. But beyond that, it's a matter of personal preference, I suppose. What are your thoughts on that?
Well, there's glad you mentioned that. I'm actually just in the midst of reading this new article that just came out a few weeks ago. It's
Oh,
this big study in Sweden where they've actually followed a group of people with type 1 since they were diagnosed 30 years ago.
wow.
And they have all their A1Cs since then. And they asked this question. I was so shocked. I just found this article maybe an hour ago. So at what A1C are you safe? And specifically they were saying at what they call weighted A1C, if you sort of add up all their A1Cs over the course of
Mm,
all these 30 years, um, below what A1C do you simply don't see people running into what's called proliferative retinopathy or serious eye disease or early kidney disease. And I'll look actually. When they looked at 20 years, it was actually 7.6%. But here at 32 years, they are saying it is. I'm just going to look this up here. Well, don't believe me. So it is 7.3%. So, but there's still other evidence that suggests maybe it's 6.5%, where you simply don't see much benefit beyond that. But this is limited data. This is 400 people. So we're learning more and more all the time. But it's always surprising, I think, for people to see that, since I certainly see lots of folks who are really fighting to get, deep into the 5% range. And if that means their life is suffering, that's a
mhm.
problem. That's a hell of a trade-off.
Right. Absolutely. I think you had referenced this as well in your TEDx talk from back in the day, where, at what threshold cross do we experience the benefits and at what point do they no longer matter as significantly? But a great conversation to have. We don't have to be pushing for a 4.9. You don't have to have non-diabetic numbers 24/7 to avoid the worst end of diabetes complications necessarily. And of course, this helps protect mental health as well, where we're not always obsessing or punishing ourselves for having a 200 blood sugar on a Monday, because we forgot to bolus or something. I think that there's a lot to be said about it's how we respond to those numbers. Do you make an effort to bring it back down, or do you leave it there for a month? Right. And then it becomes a little bit different. You look at distress or burnout and all these other cases. Is that something that you find as part of your work, discussing distress and burnout and coping mechanisms for that?
About, you mean stress and burnout about the which one?
Diabetes in
Uh,
general.
well, I I actually wrote a book called Diabetes Burnout, so yeah, I'm kind of familiar with that.
I was hoping
Um,
you'd mention that. Yeah.
yeah, it's really old, so don't bother buying it. You can probably find it for like $1 on eBay at this point. Um, but yeah, I mean, it is probably the most common issue that we see. That and again, I literally was just talking about this morning with a fellow, and we talked about it. And I said, as I explain it to people who don't have diabetes, I say, look, the day you, and you know this, the day you develop type 1 diabetes, the universe has just said, congratulations, I have a new job for you. There's no pay, there's no vacations. I'd like
Right.
you to do forever, but don't worry, I have a very big reward for you. Maybe if you're lucky, 10, 20, 30 years from now, here's your big reward. You know what you're going to get? Nothing. Nothing. Meaning nothing terrible is going to happen, which is
Right.
wonderful. Except we as human beings respond to best to immediate, tangible, positive incentives for our behavior. That's why there's a place called Las Vegas. And so it's understandable. It's actually odd that most people don't burn out. A job where there's no pay and no vacations and you're asked to do it forever, who wouldn't get sick of that?
Right.
So let me ask you, by the way, um, how do you keep your sanity? I mean, you think about diabetes a lot. You say it's the number one thing for you. We find that most people find some way to give themselves a break,
Mm.
have a little time off. Um, how do you manage to avoid burnout, do you think?
That's an excellent question. I don't have a specific answer outside of a belief that I'm built different.
Hmm.
Uh, and what I say by that, or what I mean by that, is the level of consistency and discipline that I have shown with my diabetes is inconsistent with how I used to act in my life. So before I was diagnosed, I was spontaneous, reckless, adventurous, did not follow the rules. And then diabetes happened, and there's a transitional period where I still didn't take care of myself. I was not responsible with it. But there is a moment for me, and maybe this is rooted in some mental trauma potentially. But I almost died in a foreign country from a hypoglycemia, and terrified me. Right, I came back from that trip wondering if diabetes was going to be my end, and initially dove into a bit of an obsession with research, having a need internally to define why blood sugars go up and down. From there, found healthier coping mechanisms that allowed me to have flexibility in life. But since then, it hasn't felt like a chore, but rather, this is what you do. This is
Hmm.
life. And a bit of acceptance, I suppose, as well, mixed in there.
That sounds great. And I certainly hear things like that a lot in terms of how people move from feeling, if you will, I don't know, see diabetes a burden and feel almost kind of at war with it,
Mhm.
to getting to a place where they go, well, this is kind of what I need to do. And it kind of, they've managed to find a way to fit it in their life so they're not just fighting it.
Mhm.
And I think also the other thing, though, that can help, and maybe you're a good example of this, is there are certain kinds of people who have the right personality for diabetes. I mean,
Mhm.
we know that people who score high in a personality measure called conscientiousness, which is people have a certain degree of self-discipline in their life. They tend to be kind of organized, tend to think about the future. Those people can deal with diabetes better. There's also good evidence that people who score high in conscientiousness live longer, whether they have diabetes or not. And you can sort of see why. It kind of, diabetes is a job, but if you're organized enough, um, and I guess as you're saying also, if you can have a scary event that kind of slaps you in the side of the head that says, "Hey, maybe you should like snap out of it and find a way to fit this into your life,
Right.
it becomes easier in some way.
Absolutely. And I will say, like the bookshelf behind me, the whole top row is mindset books and, how to reframe situations. I've certainly been able to reframe how I view my diabetes as a positive versus something that's negative. Initially, I thought that it made me less of a person, weak. I was embarrassed by it. But now I see it as a badge of honor. I'm living life on expert mode. I got all this extra stuff I have to do just to stay alive. I'm pretty good at this, and realizing that diabetes makes me healthier, I think has been interesting as well. Where I know I would not be as consistent with exercise if I didn't have blood sugars to worry about because of the benefits. I wouldn't know about nutrition. I wouldn't, uh, drink water as often with the knowledge that hydration is helpful. So it's certainly been a benefit, but it was a journey to get to a place where not only did I accept it, but also was grateful for it in a sense.
Yeah.
It's an
Well,
interesting journey.
that's really lovely. It makes me think of we did a small project years ago, which someday I want to do in a much bigger way. We called it the Something Clicked Project. And
Mm,
we went out into the world and we looked for people like you. And we said, we want to find people who went through some period of time where they really were kind of ignoring their diabetes. They were at war with it. It was not a big deal, but that something happened, like the event you mentioned, the country.
mhm.
Something happened that led to a series of changes. And now they were at peace or engaged or working well with their diabetes. And we did this whole study based on what clicked, what was the event, and we
Right.
heard the most amazing stories. Sometimes it was finding a doctor who treated them differently. You remind me of one person who discovered he was about to be a dad.
Oh,
He
wow.
said, I need to think about my future. But I wanted to, if you don't mind, I want to tell you one story because I remember my
Please.
favorite story from the early Something Click project.
Mhm.
It was this fellow, he was I think he said his last year in college, if I remember correctly. And he said, I always felt at war with diabetes. I always felt one down. I felt like damaged goods.
Mhm.
And I just hated diabetes. And I wasn't going to let diabetes control my life. I was going to show diabetes I was in control, not diabetes. And the best way for me to do that was to ignore it. So there, diabetes.
Oh,
So he was really doing the minimal amount possible. And he said something happened one night in college. He said, here's what it was. I was sitting around with my dorm mates, a bunch of guys, and we were talking about cars and what kind of car we might next buy and the different features. And we were talking about automatic transmissions, the cars you can still buy with manual transmissions and going back and forth and pros and cons. And he said, this light bulb went off. And he said, whoa, I have a manual transmission pancreas. I'm not damaged goods. I just happen to have a manual transmission pancreas. I didn't ask for a manual transmission pancreas, but
yep.
I can do that. And oddly enough, that was it for him. That thing kind of shifted for him. And he said, now I'm ready to move forward with diabetes and bring it into my life. Anyway, there's so much, and I hope you're hearing these stories from people you work with. There's so much wisdom out there that people need to teach us about the things that click for them, just like what happened to you.
Absolutely. And what a fun way to describe diabetes too. Manual transmissions, a little extra input than automatic, right? You got to learn how to do it, but totally doable.
Well, like you, he was talking about some of the positives. He goes, wow, I have way more control over my pancreas than most people I know.
Right.
And he also then later did talk about, just like you did, he said, there's positives to diabetes. Diabetes, because of diabetes, I'm way healthier than I would have been otherwise. And we have some tiny bit of evidence. I can't make too big of a deal about this. There's only been a single study um, suggesting that if you look at deaths amongst people with type 1 versus people who don't have type 1, it's kind of wild. This is from the most famous study in diabetes called the DCCT, that at least in this group of people who were doing pretty well, it looks like they may be living longer than people who don't have diabetes.
Hmm.
Now that's crazy because most people, even now, will be told, well, you have diabetes, this can take years off your life. maybe not. Maybe not at all. So anyway, there's hopeful things we're hearing about that, and we still have more evidence to collect.
Fascinating nonetheless, though. And I think a lot of that may even be correlation, but to increased awareness of health, of even if it's forced us to be aware of our blood sugar fluctuations, we see the response that our body receives with different foods, right? Oh, that food spikes me. Maybe I should stay away from that or limit my exposure to it. Whereas the non-diabetic wouldn't be aware of that. Oh, I can have donuts every day. Doesn't matter, right? And then they won't see the response.
Yeah,
So that is interesting. I'd love to see that study furthered.
yeah, I can send it to you. Yeah, I mean, it's for those of us who don't have diabetes, type 1 or type 2, it's we get to float along like everything's fine.
Hmm.
Like, well, I'm not sick. I can eat, do what I want. I can exercise if I feel like it, eat what I want because I'm okay. But in truth, all of us, myself included, have some unnamed condition. It's not diabetes. For me, given my family history, I probably have what we might call pre-heart disease.
Mm.
But there is nothing called pre-heart disease. So I don't have to worry about it. I just pretend it's not there. So you're right. I think there, to some degree, it's that extra awareness, even though didn't necessarily want to do it, that extra focus on one's health,
Hmm.
that may be why we're seeing these really early but fascinating findings.
Absolutely. Wow. Well, and that kind of tying it back to the mental health conversation as well, how if you are aware, if you are taking relative control over blood sugars, you don't have to be obsessed, but if you are giving it your best shot, I feel like from what I've experienced and seen with my clients that increased control often, well, maybe not always, but often leads to more peace of mind when you have consistent blood sugars and they're not, roller coaster all day, up and down, up and down. I wonder, from your perspective or what you've encountered or studied, is there a correlation between increased control of blood sugars and less strain mentally?
Well, I want to say two things about that. So we actually did a study like that. We published it a couple of years ago where we followed about 600 CGM users, actually, Dexcom users. And every night we basically said, how's your day been? How'd you feel today? And we looked at how that was linked to their time in range and their time above range and their time below range.
Hmm.
And we definitely found quite significant correlations that that better time in range, less time above range was without any doubt linked to people feeling better.
Hmm.
Now, I want to tell you with my research hat on something important though.
Hmm.
I can't tell you exactly why that's true. In
Hmm.
other words, we couldn't, blind people to what their CGM readings are. So in other words, were they feeling better because physiologically they felt better because their blood sugar's in range, or were they feeling better because they could look at their meter and go, wow, I have better time in range?
Right.
So some of the elements, though, I think clearly were because they simply were having less fluctuations. They had less, well, no, because they had better time in range. At least some of it, it's hard to imagine it wasn't.
Hmm.
Um, I just want to do one caveat, though. There are a subset of people for whom having better, and I have to keep using the word diabetes control, but having better time in range is a strain because they may not have figured out the way you have streamlined it for yourself and your clients to be able to do that without it simply sucking up all of their mental energy. That if I have to
Absolutely.
be, we have an insulting term for those folks, we call them professional diabetics, where they can have pretty good outcomes, but they're consumed. It's obsessive compulsive. They're thinking about diabetes all the time. It's literally their job.
Right.
And that's I wish better for them. I'd rather they have a more interesting life. That's all. Um, so it can be a strain. So it's finding that point of mid-ground where you can have the best glucose control possible, but not be consumed by having to think about and be worrying about it all the time. I don't know. Is that fair to you? Are you okay with that?
Oh, absolutely. And I think that I can add personal experience to that as well, where my terrifying experience overseas, where I had a pretty scary low, came back, and I developed into a professional diabetic, where it was, hey, do or die. You figure this out, or it's going to get you. For me, that's what I was telling myself,
Yeah.
and as a result, limited everything, get the blood sugars to be consistent and stable, and for a while. I've certainly restricted lifestyle in order to accomplish stable glucose lines, and it wasn't for probably 6 months to a year till I was sitting down one day and realized I had built a prison around myself.
Oh,
I can't eat that food. I can't go on this vacation. Can't hang out with friends past 10 p.m. or whatever it was. And it was another pivoting moment for myself where I'd realized this isn't how I want to live my life long term. I had to make some adjustments, and of course, that's where I shifted my strategies within diabetes management to be a bit more balanced between control and quality of life. So, very important conversation. I think a lot of people follow certain trending diets just to accomplish those stable lines, not realizing that they hate their life, but it's for diabetes, right? They're like, well, it's worth it because I have a perfect A1C and I'm always in range. Like, but is it worth it though? Like, really? And that was something I had to kind of fight through my own journey.
Yeah, boy, you said it so well too. And again, I would say literally everybody I see, uh, I always think I have this picture, this balance scale in my head, and about where are they with their point of balance or compromise between those two extremes, right? So I'll meet people with an A1C of 16% who will say, I really can't be bothered to think about diabetes. I just hate it so much. And I'll see people with an A1C in the 4% range, right? Who can't not think about diabetes and just freaking hate it.
Right.
But they will not let go. They cannot let go of having perfect blood sugars. And everyone's looking for like how you figured it out for yourself. They're trying to find what's that point of balance between I want to do everything I can, but I got to have a life. So where's that comfortable point of compromise? And helping people to figure out uniquely what it is going to be for them at this point in time, because that may change over the course of time, is in many ways what helps people to avoid burnout and really set them free. Because otherwise, you just feel like you're being bad all the time, like I'm being in bad.
Right. Absolutely. Well, I think that you nailed it with this fear of losing control. And I talk to my clients a lot of different stages of diabetes management, depending on what you're working on and fine tuning. And one of the final stages is that things are controlled, but you're fearful of losing that control, of experimenting, of going out to dinner and having a food that doesn't have a carb count. You're fearful of losing your beautiful graph, your odd time in range. And it's kind of like the final step, I think, of finding that balancing point. But as you mentioned, fear, I could be wrong, but I feel like one of the more common fears is of hypoglycemia, of people either fearful of what could happen if they go too low. Maybe they haven't experienced a significant hypo, or maybe it's just the feeling that we all experience. But what has been your experience in chatting with people about fear of low blood sugars?
So I've seen a lot of people like who are struggling with this. It is very, very normal. We've done a lot of research in this area for many decades. And I want to say a couple things about it. First of all, if you or anyone who's living with type 1 finds that you're wary and fearful about hypoglycemia, you should be, right? That's right. That's normal. But it's when that fear gets too big, that's when it becomes a big problem. When it really begins to run your life, when it becomes such that fearful about going out or fearful about, probably the most obvious one and the kind of problem we see the most is when people just aim to have their blood sugars high all the time.
Right.
I work with many people who are terrified if a blood sugar is ever lower than 200 milligrams per deciliter, for example,
Yeah.
or if they have a CGM and they ever see a down arrow of any kind. Fear is running their life. And underneath that fear is they've lost confidence in their body.
Mm.
I can't take my body anywhere. What's it going to do? If I get behind the wheel of a car, what if I go to sleep tonight? If I go out somewhere, who knows what the hell it's going to do? And it's having lost confidence in your body. That's the heart of what we call the hypoglycemic fear syndrome.
Mm.
And it becomes incapacitating for many folks. Part of why it happens, and maybe you experience this as well, is physiologically there's something that occurs that's really awful, which is the initial feelings, the symptoms you feel when your blood sugars start to drop, shaky, sweaty, heart palpitation, things like that you might have noticed, are the same kind of feelings you might have if you get frightened.
Mm.
And
Yeah.
that's because it is, in fact, the same hormonal release. But having a single event like you've had, or multiple events like many people have had, that can get, at a physiological level, confusing. So if I suddenly notice that my chest is getting tight, or my heart's palpitating, or I'm feeling tense, does that mean I'm having a low? No, I'm scared. Or maybe I was scared before. Maybe I'm just getting scared about something, or nervous, or maybe I thought about something. But
Mm-hmm.
it's sort of, they start negatively reinforcing each other, and becomes a real trap to help people get out of.
Mm.
So we can help almost everybody recover, but it becomes, when it gets entrapped like that, it becomes a big problem.
Absolutely. And I can certainly speak to that as well. Coming back from that experience overseas, when I landed home, I recognized that as being intertwined, and I experienced my first ever panic attack. I had never experienced it before, didn't know what it was.
Yeah.
I knew what it was, but I didn't know how it felt, right? And that for me was a scary realization that I can't differentiate between the two. Am I low, or am I just terrified? Like, where is the line being crossed? So I found myself double checking with finger sticks, even though I wore a CGM, didn't trust any of my devices. It was an interesting time. The mind is a powerful thing, which is both amazing, but also a bit frustrating
This
sometimes.
is big problems sometimes, big problems.
It really does.
Yeah.
Yeah. So
But
within that realm, then, what are the recommendations as you've walked people through this process? Is it, I doubt exposure therapy is the first thing you go to, but I'm sure there's other strategies that you've recommended.
yeah, although exposure therapy is exactly what you eventually need.
Hmm.
Um, so we talk about two broad set of strategies. We talk about this, what we call the hypoglycemic fear syndrome. One is what we call the be safe strategies, that you want to help people basically minimize their actual risk of having a severe, scary low blood sugar. So what's the obvious step one? Do you have a CGM? Right.
Right.
So do you have emergency glucose around if you need it? You know,
Hmm.
how many stories do you have to hear of someone saying, well, I was out for a run and I got low and I didn't have anything with me. Are you kidding? Do you have stuff around? I mean, now we have, stable glucagon. We have, Baqsimi. We have, the other products that are available. Thank God, right?
There you
For
go.
that.
Vaccine is right here within arm's reach.
Yeah. And hopefully you'll never ever need it. But it's so cool that we have these things now, that they exist.
Right.
So there's the strategies that we use to help people literally be safe.
Hmm.
For people who are really locked into hypofear syndrome, that's not enough. So then we have to have a separate set of strategies, which we call the feel safe strategies. So even though literally your risk for hypo is pretty low now, or severe lows are very limited, you may still feel unconfident in your body. Like, I still don't feel like I can trust my body. So, we do a couple things. First of all, there's good evidence that just CGM does help with that to some degree. The thing, and for people for whom it isn't severe, good old exposure therapy is plenty. So I can think of someone who I worked with who was terrified. This is appropriate for you. Was terrified of exercise,
Mm.
and so the most important thing about exposure therapy is you start really slow. So step
Right.
one for him was to take out his mountain bike, which he loved,
Mm.
and to actually ride it to the end of his block and back.
Hmm.
with lots of Baqsimi and gummies on him, just in case.
Yep.
That one block. And he was surprised when he got home and he went, oh, kind of okay. So you do it a couple more times over the next week. Okay.
Hmm.
And it didn't even need much help. So he began to expand that and realize that he could regain his confidence just by exposing himself to slightly more and more risky situations.
Hmm.
Um, I'll mention just one other thing that for many people, they need this other thing, though, which is I'm trying to, we had some jargony name for it. It's escaping me, but it's helping people get better at recognizing and distinguishing, is this fear I'm feeling or is this a low?
Mm.
So I've done this a million times. I'll give you an example. I was thinking of someone I saw not too long ago, and just talking to her about her last severe hypo, she started to get very frightened.
Oh, wow.
And I said, well, where do you feel it in your body? And she goes, well, I can feel it right here in my chest. I can feel my chest tightening. And I said, okay, well, and then she said, I better check. I better check. And I go, well, hang on a minute before you check. And I said, we just did a very simple little relaxation exercise. Just take a deep breath, hold it, let it out. Do that a few times. How's your chest doing? Well, it's not tight anymore.
Hmm.
So we had to then use her CGM as a way to say, if you can make these funny symptoms go away just by breathing, it cannot be hypoglycemia. You
Mm.
can't relax yourself out of a hypoglycemia episode.
Right.
Try. You can't do it. So if we're able to help people distinguish that, if a couple deep breaths, you notice that your chest isn't tight or your heart's not palpitating, oh. So it's almost a form of exposure therapy. You're beginning to disconnect, and that people can recognize the real cues when they're low. And there's other things beyond just the standard ones. There's the mental fogginess and all sorts of other things that we help people can rely on better. So it's distinguishing all that along with actually good old exposure therapy really is pretty helpful.
Very interesting. What I find fascinating is that I accidentally stumbled upon that, but I think it wasn't from the best of routes, where I also found myself fearful of going to the end of the block on my bike, right? And I did, okay, today, end of the driveway and back. Tomorrow, another few steps past that, right? And same thing. I had a backpack full of juice boxes just in case, right? And for me, that baby steps is what got me closer towards my goals. I suppose for me, it was stubborn determination. Like, I have to push through. I got to beat this thing. And that was very helpful because I also had physiological responses. And maybe I should do a full episode on my experience. I haven't shared any of this really. But if somebody's phone set to vibrate would go off near me, I would feel that because that was the same vibration tone that my Dexcom low alert would give off.
Oh, wow.
So this
Wow.
little, like, I could feel it in my chest and get tight. I'm like, I know it's not me, but oh my gosh. And I could feel it in my bones. It was
Yeah.
very interesting. So even logically convincing myself, that's not you. You're not low, but I feel the fear. And it was hard to decipher initially.
Yeah.
So
So we
yeah.
should add that to the list. It's sort of, for people who don't end up seeing someone like me, it's personal determination to be willing to put yourself in that scary position. That's what, those baby steps are, right? You're over and over and over again, you're putting yourself in those scary situations bit by bit by bit, and doing it in a bit by bit way, though.
Right. Well,
That's
I love
good.
the steps that you had as well. The be safe, like actually protect yourself. Don't put yourself in a dangerous position if you can avoid it, but then feel safe. And that's such a great next step, I feel like, for people who would need that next step. And it sounds like a lot of this is rooted in that first step, of course, be safe, where if you have the control, you can give yourself that mental peace of mind, the confidence. I think that a lot of fear is rooted in uncertainty. Is this low going to be the end of me? How much lower am I going to go? And the uncertainty can certainly lead to a lot more fear,
Yeah.
uh, in
Let
my
me,
experience.
if I can, let me add a word though, because, and maybe this will be helpful. So there's fear and then there's anxiety.
Mm.
And and I think I've heard you talk about, I mean, fear is a reasonable, helpful emotion that is useful to us. And if it's helping you notice that something might be wrong right now, that's can be of value.
Hmm.
When it becomes too big, it's a problem. But anxiety is almost, in almost every case I can think of, it's fear about the future.
Mm.
It's, what might happen to me, what could happen. And so it isn't necessarily that an alarm bell has gone off, but walking around in anxiety is any minute now I could go low, you know. And
Sure.
not only that, but I won't be able to do anything about it, right?
Right.
And it's again regaining confidence that your risk of going low isn't that much. But even if it is, you're going to be able to deal with it.
Hmm.
So oftentimes I mean, it's difficult to arrange that these days, but oftentimes I want people to hang out and go low with me
Mm.
so they can have that experience of saying, well, I'm low and guess I better do something about it. And okay, well, that worked.
Right.
And, it's the tough one though. I mean, there's not even enough written about this. We know it might be as many as our last study suggests maybe 30% of people with type 1 are walking around with really high levels of fear of hypoglycemia in such a way that it's really impacting on their lives. And no one really even writes about or talks too much about, how do you address these things? And we're doing our best to figure out a bigger way to talk about this, and maybe something digital we can get out to folks. And
Hmm.
it's, it's in many ways, I think we're not worrying about it as much as we used to because our CGMs are so good now and they're
Right.
so widespread. But that's not going to be everything, unfortunately. It's not enough. Be safe is not feel safe.
Yeah. Well, I'm excited for all the work you guys are doing. I know that you've got a lot of really powerful impacts that you've had over the years, and I know it's going to continue. I've certainly read through a few of your pieces of work. I even found that old TEDx talk, and I think it's still applicable. I think it's still helpful even today. A lot of the points you made.
It's so
So,
embarrassing. You made me think I have to do another one at some point just because that must have been at least a decade ago. We gotta update it or something. But
yeah, I'm sure you have a
I'm glad it still
slightly
exists
different.
out there.
Yeah, well, that's the beauty of the internet, right? Everything's out there and it's around. But I actually wanted to give you a chance to help our audience find you, especially if they would benefit from your resources or your assistance.
Yeah.
What can people look up, or is there a website? What's the best way to find more of
Sure. Well,
you?
let me mention a couple things if I can. First of all, if anyone is viewing us and is concerned enough that they say, it'd be nice to find a mental health professional who knows about diabetes. Um, the most useful thing is to just Google the ADA Mental Health Registry.
Hmm.
ADA is American Diabetes Association, and they have an online registry. So all you do is you could just put in your zip code, and it'll tell you who in your area is a social worker, psychologist, counselor who is, at least to some degree, knowledgeable about diabetes, the kind of stuff we're talking about. And that's pretty new. And so it isn't, again, there's not a lot of people. There's many of you who are going to put your zip code in and discover the answer is no one. But the list is growing. So it's a very valuable thing. If you happen to be in California or in the San Diego area, the best way to learn more, well, actually, if you're in the world and want to learn more about what we do at the Behavioral Diabetes Institute, all you have to do is come to our website, which is just behavioraldiabetes.org. And I refuse to spell it. Behavioral, figure it out, diabetes.org. And we're here like you, in sunny San Diego, of course. But people come and visit us online from everywhere in the world. So there's a lot of fun things on our website, a lot of freely available materials and things that people might enjoy. And I should probably mention what we're most famous for,
Oh yeah.
which we didn't realize this would happen, but it's available online. It's downloadable for free for anybody who wants them. But many years ago, in our programs, when we ask people, so what drives you crazy about diabetes? Number one is always what we call the 24/7 problem. I don't get a break. Number two is always, despite my best efforts, blood sugars just don't cooperate all the time. Um, but number three is always, you have no idea how annoying people are. And it could be family members, friends, coworkers, strangers, just people saying the stupidest things to you about diabetes. And we said, wouldn't it be nice if there's some way you could respond that would be helpful other than just punching that person?
Right.
And so we figured out the solution. I don't know if I have it in here. Oh, I do actually. We figured out the solution was to develop what we call the diabetes etiquette card for people who don't have diabetes. So next time someone says something annoying, you can just say, oh, you must not know the rules about how to behave. So there's 10 rules of diabetes etiquette. And they're designed to be somewhat amusing, but it's an easier way rather than punching someone. So maybe you should read the rules of etiquette. Number one, I'll just tell you a couple because you'll enjoy this. Number one is don't offer unsolicited advice about my eating or any other aspect of my diabetes. Seems reasonable. But my favorite has always been and will continue to be number 3. Don't tell me horror stories about your grandmother.
Right.
Right. I'm sorry about what happened to her, but I don't need to hear about that right now. So anyway, but there's things like that we made that are kind of fun for dealing with the people who are in your life who are acting like the diabetes police that you can see online and download on our website. Sorry being so long-winded about this, but we're so proud of them that, there's about 500,000 of them in circulation around the world now, and in the strangest languages too. But I don't know, I have one in Arabic. I can't read it, but I'm so curious. Like, what did they do? What did they do in my etiquette card in Arabic? Mandarin, German. Anyway, but I encourage people to come visit us, see what's going on, and hang out, stick with you, get connected to other people, and you'll be fine. Odds are good. If there's one thing we all know, and another part that we always like to tell people, just remember, it's the 21st century, and what we now know is with good effort, with a good healthcare provider, and with good effort and time you put into your diabetes, odds are pretty good you're going to live a long and healthy life. And everyone's used to hearing all the scary messages. But the evidence says, yeah, terrible, scary things can happen, but with good effort and care, that's pretty good. You're going to do really fine. So
absolutely,
it's that positive message and hopeful message, what we call evidence-based hope, that people don't hear enough. So
I love that. What a fantastic note to end this on as well. I'll add that I was laughing a little bit when you brought up the diabetes police cards, because I actually have one of those in my closet.
okay.
I've got one from like 5 years ago. So yeah, everyone should check that out. It's helpful. It's entertaining. I think it's a fantastic idea. But again, I mean, we could talk for hours. You're such a fantastic conversationalist, and you've got a lot of wonderful tips to add. I want to respect your time and thank you for your time, Dr. Polonsky, for coming on, sharing your experiences, your recommendations and stories. I think this has been fantastic, and a lot of people are going to find it helpful. So thanks you.
It's really been my pleasure. Keep up the good work.
Thank you. I appreciate that. Well, I'll let you get back to work. Thank you, everybody else, for watching. Definitely go check out Dr. Polonsky and BDI if you've got questions, need resources. It's really a fantastic place. So yeah, thank you, Dr. Polonsky, and thank you, everybody else. We'll catch you next time. Keep up the fight. What a fantastic interview, right? I mean, amazing thoughts throughout. I thoroughly enjoyed that conversation with Dr. Polonsky. And of course, do check out everything that he mentioned. Go check out his website. And if you're in San Diego, like the both of us, go to his offices, check out what they've got to offer. But you heard me mention about halfway through that interview that we've got this challenge we ran people through that guaranteed 90% time in range. And of course, towards the end, we discussed how an improved glycemic control, improved time in range, oftentimes relieves us of the burden of mental capacity being required to manage our blood sugars, where if we have better control, we oftentimes get to relax a little bit, right? Where if we have better control, we have less risk of complications. So better control oftentimes helps us to avoid or at least limit our exposure to diabetes, burnout, and all these other negative sides of diabetes. And so if diabetes is a little bit more out of control than you'd like, and you're looking for a way to get blood sugars to calm down, to stabilize, and of course, if you're wearing a CGM like myself, if your goal is to get your time in range improved, then we've got that challenge for you that you can actually go register for. It has a guaranteed 90% time in range towards the end of it, so that you can get the tools necessary to get your blood sugars to cooperate. That is the goal. So if you'd like to hit your first or next 90% time in range, you got to go over to fixmybloudsugars.com. That's the website. It is plural with an S on the end. Fixmybloudsugars.com. Go register for the challenge, and I will personally see you in there, along with the rest of our crew. As you heard me mention, there's also an amazing community in there where you can get support and feel like you're surrounded by people who get it, just like you. So, fixmybloudsugars.com. Thanks for hanging out with us, and we'll catch you next week. Keep up the fight.